Hello and welcome to our channel today. We're going to clarify an important distinction between two types of infections that can affect your health. Sexually transmitted infections or STIs and urinary tract infections or UTIs. Understanding these differences is crucial for proper diagnosis, treatment, and prevention. Let's dive in. Don't forget to subscribe, share this video, and drop a comment below. What are STIs and UTIs? Sexually transmitted infections, or STIs, are infections that are primarily spread through sexual contact. They can be caused by various pathogens, including bacteria, viruses, and parasites. Common STIs include chlamydia, gonorrhea, syphilis, herpes, human papillomavirus, or HPV, and HIV. Urinary tract infections, or UTIs, are infections that occur in any part of the urinary system, including the kidneys, ureters, bladder, and urethra. They are typically caused by bacteria, with Escherichia coli or E. coli being the most common culprit. UTIs are not necessarily transmitted through sexual activity, but can be influenced by factors related to sexual activity. Symptoms. STI symptoms. The symptoms of STIs can vary widely depending on the infection, but may include pain or burning during urination, unusual discharge from the genitals, itching or irritation in the genital area, pain during intercourse, sores or warts on or around the genitals, and flu-like symptoms such as fever and body aches in some cases. UTI symptoms. UTIs typically present with symptoms such as a frequent, urgent need to urinate, a burning sensation during urination, cloudy, dark, or strong-smelling urine, pain or pressure in the lower abdomen or pelvis, and a feeling of incomplete bladder emptying. In severe cases, there may be fever or back pain, which might indicate a kidney infection. Causes and risk factors. STIs. Transmission of STIs occurs through unprotected sexual contact, including vaginal, anal, or oral sex. Risk factors include having multiple sexual partners, engaging in unprotected sex, having a history of STIs, and not using barrier protection like condoms. UTIs are commonly caused by bacteria entering the urinary tract. Contributing factors include poor hygiene, urinary retention, certain types of birth control like diaphragms, and anatomical factors. Risk factors for UTIs include female anatomy, sexual activity, pregnancy, and conditions like diabetes or a weakened immune system. Diagnosis. STIs diagnosis often involves a physical examination. Laboratory tests such as urine tests, blood tests, or swabs of the affected area. Some STIs require specific tests to identify the pathogen, such as nucleic acid amplification tests, or NAATs for chlamydia and gonorrhea. UTIs. Diagnosis typically involves a urinalysis to detect the presence of bacteria, white blood cells, or blood in the urine. A urine culture may be performed to identify the specific bacteria causing the infection and determine the most effective antibiotics. Treatment. STIs. Treatment varies depending on the specific STI and may include antibiotics for bacterial STIs, antiviral medications for viral STIs, or other targeted therapies. It's important for sexual partners to be treated simultaneously to prevent reinfection and further spread. UTIs. UTIs are generally treated with antibiotics prescribed by a healthcare provider. The choice of antibiotic depends on the bacteria identified. Increasing fluid intake and using pain relief measures may also help alleviate symptoms. Prevention. STIs. Use barrier methods such as condoms or dental dams during sexual activity. Get regular STI screenings, especially if you have multiple partners. Vaccinations are available for certain STIs such as HPV. UTIs. Maintain good personal hygiene, including wiping from front to back. Stay well hydrated and urinate regularly to flush out bacteria. After sexual activity, urinate to help clear bacteria from the urethra. Conclusion. Understanding the differences between STIs and UTIs is crucial for effective management and prevention. While STIs are primarily spread through sexual contact and can affect various parts of the genital tract, UTIs are infections of the urinary system that can occur independently of sexual activity. If you experience symptoms of either, consult with a healthcare provider for accurate diagnosis and appropriate treatment. If you found this information helpful, please subscribe, share, and drop a comment below. Feel free to leave any questions or comments below. Thanks for watching and take care of your health.